All right. So tell me a little bit about what's going on.
Okay. So I was thinking about it the other day and I was like, this poor guy, I just have pain everywhere. So that's not good. But probably my biggest problem area is my lower back.
Okay.
I have bulging discs that come and go. And sometimes it's okay, and sometimes it either comes back or flares up, and it's really painful and hard to move. And then I was telling you before, also I'm really tense, just kind of, and think a lot of that intense pulls on my muscles. And I can tell when there's certain muscles being pulled that it causes my back pain to be higher.
Right. Okay. So sometimes all those little things trigger something, right? But that might have been something that was triggered before, right? Our subconscious is lazy. It doesn't want to evaluate every situation as a new situation, right?
Right.
So it's like, oh, there's a twitch. Oh, here we go. Back pain again, or what, whatever it is. So
Mm-hmm.
part of this is to know that the only connection to the past is our own thinking, right? Because
Okay.
life is not a movie. It's this is one slide, and then this is the next slide, and then this is the next slide. So because of that, second chances are real. Forgiveness and repentance work, right? Miracles happen
You're right.
because each moment is its own moment in time. So one moment something can be one thing, and the next moment it can be something totally different if the information is changed.
Okay.
A lot of times then we get to decide how much of that we want to accept, right? How much are we willing to
Right.
allow ourselves to be opened up to new possibilities, right? So when somebody's pain goes from a 9 to a 7 to a 5 to a whatever, right? It probably goes from a 9 to a 0, and then we accept it as a 7. Then 7 to
Okay.
a 0, and then we accept it as a 5. Because if we've been thinking a certain way for so long that all of a sudden change in reality, the ego's like, whoa, wait, hold on. I've already formulated this path as the easiest, least resistance way to get to death, basically, right? And now all
Mm-hmm.
of a sudden,
Okay.
there's all these new possibilities, right?
Right.
So that's why sometimes it can take a couple times to get it to stay, because life happens, environment's difficult, and our subconscious is the history of the past, right? It wants to use
Right.
what it's known from the past to figure out what's going on in the present.
Okay. Like previous knowledge
Yeah.
or
Or
feelings.
or
Okay.
previous emotions or feelings, right?
Okay. That makes
Right? Like
sense.
we're reliving our past disappointments as if they're happening in the moment all the time.
Okay.
Okay.
Makes sense.
So after I healed myself, if I didn't take a twitch as just a twitch, right, I would have convinced myself, oh, that nothing happened, right? Here we go again. Here's the pain again. But by doing something totally different too, right away, it showed the subconscious that something must have changed, because yesterday you couldn't paddleboard because you couldn't even stand on a paddleboard because you had no balance and because you were in pain and you couldn't move, right? And
Mm-hmm.
now you're paddleboarding. So something must have changed.
Right. Okay. Yeah.
Right. So then when I see it in other people, it continues to reinforce that possibility that, oh, yeah, I must have healed myself because look, all these other people are healing as well. Right. So kind of like what I told your sister, right? If life is about purpose, right? If you know something to be true, sharing it then solidifies that.
Oh, yes, exactly.
Right? So
I agree
don't
with
just
that.
hog the miracle and don't share the experience,
Right.
right? Because eventually then you're going to convince yourself you're not worthy, or else you would have been sharing.
Okay.
Right? Make sense?
Mm-hmm. Yeah, absolutely.
Okay. So right now, like on a scale from 1 to 10, what would you say that your pain level is?
Okay, well, I may have cheated and taken ibuprofen today.
Well, that doesn't, I mean, so
So,
really, but I'll say something about that, right? Is that's the subconscious giving you an out, right? Because when the pain goes away, you can always use the
angry.
excuse, oh, well, it must have been the ibuprofen.
Yeah. Okay, well, so I would say most days I'm probably like a 7-ish. Um, Depends on what I'm doing
Okay, but what about this day?
right now. I'd say I'm probably at like a 5.
Okay, and then does that affect your range of motion? Does it
Oh,
affect?
yeah.
Okay, so
Yeah.
I only ask because the subconscious wants to see the change,
Okay.
right? So, or else it will then convince you that nothing must have happened because you're not doing anything different,
Right.
right? So relax for me for a second, okay?
Okay. I'm holding my arm up. I'm going to put my arm down a little.
All right. All right, so what do you notice now?
I think I feel more calm. Like it felt like a calmness wave just over my back.
Okay. Okay, relax.
Relaxed, maybe relaxed is a better word.
Okay, so relax one more time for me, okay?
Okay.
All right, so now what do you notice?
Can I move? Can I move to answer this?
Yeah, for sure.
Okay.
Well, that's what I was going to ask you to do next, but yes.
Okay. Sorry, I'm jumping ahead of you.
No,
Yeah,
you're all
because
right.
mostly I feel the pain not when I'm sitting, but when I'm moving.
Yeah.
And I grunt like an old lady getting up off the floor. So I'm going to get on the floor. I said I grunt like an old lady, like old ladies grunt. That's not nice to say.
That's all right.
Okay. Oh, and a puppy came to see me. Okay. Oh my gosh. I'm like, that didn't even hurt. I can't. Okay, so I laid on my stomach, which I'm not supposed to do because that'll like get me stuck. Look at me. You can see me. Look at me. I'm moving.
Yeah, it's awesome.
Like it didn't hurt at all to get off the floor and I didn't grunt. I'm like, you can't see. You can see me. I'm just swaying. I'm swaying.
I can see. Maybe you should grunt as a shout out to all the old ladies what's possible. There you go.
Okay, it does like it's. I'm trying to do all the things that actually hurt. Okay, when I lift my left leg, I still feel a little something in my lower left side of my back, but not the intensity I did before.
Okay, so relax one more time for me, okay?
Okay. Okay. I got to sit down and quit being crazy. Okay.
All right, so now move around and let me know how that spot feels.
Okay. I'm gonna lift my legs. There's like nothing when I lift my leg this time. What? I'm like so smiling. There is like seriously no pain at all when I lift up my left leg. I'm jumping like a crazy person now.
No, jump around.
This is so great. Like I'm squatting and bending and I can touch my feet.
So,
and I got up without grunting.
So here's the most important thing to remember. This is always more about the experience of what's possible than results, right? Because now you know what's possible. If this is possible, then what else is possible? Right? So let's say something happens later today and life sucks, and then all of a sudden, oh, my back hurts again, right? But it doesn't matter because you already know now that your back doesn't have to hurt, right? So no matter what happens today, you know where this place is. And once you've been somewhere, it's much easier to get there, right?
Okay,
this is,
yeah. Like
this is the new possibility, right? That
okay, yeah. I like
you can
that.
be pain-free, that your back isn't gonna be an issue anymore, right? And if it is an issue, it's not anyone's fault, right? It just means we have to do it again.
Okay.
Right? To get you back to that present moment where that miracle happens, right?
Right, yeah.
And sometimes it takes practice. Sometimes one time's enough, right? But that's why when you share the message of possibility, of hope, of miracles with people, it then solidifies it for you, right? Because people don't share something that's not the truth.
Right.
Right? They share what their truth is. And as you share that truth, then it becomes more real. Cool?
I like that. So I have a few. How you were saying, maybe emotions provoke the pain, but now I've seen that it doesn't have to be. How individually do we open our mind back up to getting there again to the pain-free spot?
So if something's in the now, like everything is here, right? So whether it's emotional or physical, it's all the same. It's just a little bit of disharmony that's causing a little more disharmony, right? So if something is causing an imbalance, then we just take care of it here. Does that make sense? Like we don't have to search out whether it's emotions or past relationships or childhood traumas or whatever it is, right? Because it's here, right? Because there is no connection to the past except for our own thinking, right? So we just provide balance in the moment and move on with that new possibility.
Okay, yeah. That makes sense.
Okay.
Okay.
Cool.
That makes sense. This is very exciting.
It is exciting.
Thank you.
So I'm going to post it on Facebook here shortly as soon as it downloads, okay?
Okay, that's fine.
And then you can type a comment and say what it was and what it is now, because sometimes people like to read it instead of just watching it.
Versus watching first, yeah.
Yeah.
Okay.
All right.
Thank you so much.
You're welcome.
Yeah, it was nice to talk to you today.
Okay, and call your sister.
Oh, I will every day.
Okay, cool.
Okay, thank you.
Okay, you're welcome. We'll see ya.
Okay, bye.
Bye.